Good evening, everyone. I'm your host, Isha Roy at Adore. Before we dive in, let me give you a quick glimpse into Adore. Adore is a global network of students and young professionals like yourselves, all passionate about inspiring youth to make a positive impact. We connect you with established professionals and offer a platform to learn from their journeys. On behalf of Team Maverick and Adore, we are thrilled to welcome you to this webinar on HIV affecting people. To make this session even more engaging, we kindly request everyone to switch on their cameras. And now the moment we all have been waiting for, our esteemed guest speaker tonight is Ms. Tariro Yedwa. Ms. Tariro has done Bachelor's of Science and Social Work. Ms. Tariro, it's a true honor to have you with us today. We are all eager to gain valuable insights from your expertise. Ms. Tariro, the floor is yours.
Okay, thank you very much. I hope you can all hear me. You do, right? Okay, yes, so I'm going to be presenting on HIV infected and affected children. So firstly, I'll take you through an explanation of what an HIV affected child is and what an HIV infected child is. After that, I'll go into challenges that the children are facing, both the HIV affected children and the HIV infected children, the treatment regimens for children affected with HIV, as well as some of the support services that we can offer children who are suffering with HIV. And we'll also talk about the challenges that children affected with HIV are going through, and also some of the support services available for children who are affected by HIV. So I'll start with defining an HIV-affected child. So an HIV-affected child is a child who is living in a household or community where someone is HIV. Basically, here we're trying to say that an HIV-affected child is a child whose parent or caregiver is the one who has HIV, is the one who is living with HIV. And then for an HIV-infected child now, we're talking about a child who is living with the virus. I hope you're getting me on how children become infected. So one of the primary ways in which children become infected is through mother-to-child transmission, which can occur during pregnancy, labor, delivery, and breastfeeding. So during pregnancy, labor, delivery, and breastfeeding is when a child can actually contract the HIV virus. So there are some steps and some ways that the World Health Organization and basically the health, the Ministry of Health has put in place in order to prevent the transmission of mother-child transmissions to children. And they are as follows. Okay, so when I'm talking about PMTCT services, these are prevention of mother-to-child transmissions, right? And in order for us to ensure that children get a full package of the PMTCT services, number one, we have to ensure that when a mother is pregnant or when they suspect that they are pregnant, they have to go to their healthcare provider and ensure that they get tested for HIV. This exposes them to various services, such as getting treatment on time to ensure that they stop transmitting the transmission of the virus to the child. And number two, the pregnant mother also has to go through, what is it called? The pregnant mother also has to access pre and post HIV testing services, counseling services, in fact, to ensure that they understand what they have to do in case they get tested and then they are found positive. So they have to get treatment and ensure that they get all the services that they need and they get empowered so that they understand exactly what it means being a mother and being HIV positive. We also encourage mothers to access antenatal services. So these antenatal services are services that are given to pregnant mothers to ensure that they they do not transmit the child, the HIV virus to the child, right? I think if a mother tests positive for HIV, they should be able to access antenatal care from the healthcare provider. This is where they are given treatment for HIV in the form of antiretroviral therapy. And they also get taught on how to feed the child, because when a child is under 6 months, their stomach will be too thin to receive other foodstuffs, and then so it is encouraged that these breastfeeding mothers breastfeed their children exclusively for 6 months to stop the transmission of the virus to the child, because the virus can be transmitted through fluids. So if a baby's stomach gets scratched through getting food that is not required during that age, they might get infected with the virus. So after that, the HIV exposed child is only expected to be taking breast milk exclusively for 6 months. Also, in antenatal care, the child also continues to get access to treatment until the child graduates at 2 years. During antenatal care, the child also gets HIV testing services periodically for some time until they graduate, as I said. Another way that children can also get infected with HIV is if they get sexually abused by an HIV positive perpetrator. Here we have to work with children, especially when they are able to communicate, to raise awareness on issues to do with HIV and sexual abuse, so that they get empowered, so that if they get abused, they know the reporting channels and they know when to report before they get infected. For example, if anyone gets sexually abused, they have to get medical attention within 72 hours so that they can access medical attention and treatment. Okay, thank you. So I'm now talking about the HIV effects on infected children. So for children living with HIV, the impacts on their health and development can be significant if left untreated. Common issues include increased vulnerability to infections and developmental delays. So when a child is living with HIV, they are vulnerable to sickness and to many diseases, especially if their viral load gets high. There are many challenges that children go through if they are HIV positive. Also, an issue to do with stigma and discrimination from society. If a society does not understand what HIV is and basic literacy as to HIV, then they are prone to be discriminatory against people who are living with HIV. So there is need to raise awareness against stigma and discrimination for children who are living with the virus, so that they can have a self-identity and self-esteem that is high. Also, there's an issue to do with acceptance prior HIV status disclosure. Okay, so acceptance issues prior HIV status disclosure. It is expected that between the ages 6 up to 9, children should be getting counseling to help disclose their HIV status, where from the ages 6 to 8, the children should have partial disclosure as to their HIV status, and by 9 years of age, a child should be fully disclosed of their HIV status. However, children, especially during their adolescence period, they tend to struggle with acceptance due to challenges such as peer pressure and the need to experiment what would happen if they do not take their medications. And sometimes, in some extreme cases, the children might default their medications, leading to early deaths in children. So it is advised to take caution and to monitor children when they are taking their medications. Not only monitor the time that they're taking their medications, but we monitor also the dosage, the correct dosage, and the time that they're taking their medications. And we also try to monitor if the child is actually taking the medications, because during this stage, sometimes children do not actually take their medications. Rather, sometimes they can throw away the medications unknowingly to the caregiver, or they can shove it under the bed also just to avoid taking their medication. So it is important to monitor children during this stage, especially this adolescent stage where children are prone to do whatever they can do because of hormonal changes and so forth. So also another challenge is the nutrition challenges. A good nutrition is important to help suppress the virus. So children who are living with HIV, sometimes if they do not have access to proper nutrient foods, they might have a high viral load, and that affects their general health. And you might find a child getting sick here and there regularly because they cannot afford to have nutritious food. So if you're working in non-governmental organizations or governmental organizations, it is important to assess the basic needs of a child. That is sometimes food. If the child can be able to get enough food and food that is nutritious enough to manage the child to develop mentally, physically, etc. So now we're going through to HIV treatment in children. So HIV treatment for children is primarily in the form of antiretroviral therapy as recommended by the World Health Organization. It's basically pediatric antiretroviral therapy, that is antiretroviral therapy for children, specifically for children. That is also, there are other ways to take care of children who are living with HIV, which are as follows. May I have the next screen? Okay. Other ways that we can support and take care of children living with HIV to ensure that they are healthy are as follows. The need for extra care to achieve viral load suppression. So when we're talking about extra care for children who are living with HIV, basically we're talking about monitoring the children as parents or as caregivers. We are supposed to monitor our children to ensure that they're taking the correct dosage. Also, we have to monitor if our children are taking their medications on time. And lastly, we have to also monitor if the children are actually taking the medications and they are not throwing it away. So that is the extra care and attention that these children need to achieve a viral load suppression. And also, the children living with HIV require extra care and attention. For example, they should get enough sleep and avoid staying under stressful conditions and environments. Okay, so here we have to remember that any medication that one takes requires one to sleep so that it can work effectively. So that is the same case with children who are taking their antiretroviral therapy and drugs. They need to get enough sleep, and also they need to stay under they need to avoid stressful living conditions so as to manage their viral load and to ensure that the medications are working effectively in their bodies. So it is basically it's a continuum of care and support that is needed to ensure that our children, at the end of the day, they attain a viral load suppression. Also, we should allow our children to play and get involved in support groups as they grow to enlarge their social confidence. So play is basically it is sometimes it is referred to as a child's medium of communication. So our children, when they play, they get to express their emotions and then their feelings during play, and then at the end of the day, they do not get depressed because they are expressing themselves through play, and also through getting involved in support groups. They can help enlarge their social confidence. So it is important for children to take part in support groups because support groups provide these children with the confidence because they now meeting other children who are living with the same conditions such as them, and then by witnessing such, they know that they're not the only ones who are living under that condition, and so they get confident, and then they encourage each other through the support groups, and then they know how to help each other and to offer even social support, emotional support to each other through the support groups that they'll be participating in. Also, there's need for children to access psychosocial support services. So psychosocial support services have to be given to children living with the virus because it starts with an assessment of the psychosocial needs of the child. So other organizations, they make use of community healthcare workers who are the eyes and the ears of the community who can be able to assess the child's needs on the ground, and then they can refer those special cases to a case manager or a social worker. So these are the types of care children living with HIV can need to access. And also I've talked about providing food with nutritional value to children. I think I've talked about this before, that food with nutritional value is important to help attain a viral load suppression if a child has gets a full nutrient value food. May I have the next page, please? Okay, so now we are moving on to almost the last segment where I'm talking about HIV-affected children. I'll give a brief explanation of an HIV-affected child in case you have forgotten. So I said before that an HIV-affected child is a child whose caregiver or parent is the one who is living with HIV. So these children face a number of challenges. Why? Because sometimes their caregiver might get ill, and therefore they cannot access the same benefits that they were accessing before, such as the resources that these are just some of the advantages of having an able-bodied caregiver. Financial benefits, emotional benefits, etc. So, children affected with HIV face a number of challenges, including economic effects of HIV impact from parent to caregiver. So, as I said before, if a parent is ill, then chances are high that they might stop going to work, and then they might not be able to fend for their children. So the child becomes affected because they cannot get the economic benefits from their parent or caregiver. It also affects their education because sometimes they are now in need of educational assistance, and also there'll be need of food anything that needs money. Okay, so they also face discrimination and stigma. So, as I said before, a community that does not have HIV literacy can easily discriminate and stigmatize a family that is affected with HIV. So here, basically, there's need for awareness campaigns, for just empowering the community so that they can be able to understand that HIV is just a disease, just as any other diseases out there. Children affected with HIV also face mental health problems, such as trauma from witnessing physical illness of their infected parents or caregivers. So, a child who lives under these conditions where their parent or caregiver is sick, sometimes they might get stressed or they get depressed because they are witnessing something that they do not have to see, or sometimes they are taking care of situations that are too heavy for their for their age to actually take. So sometimes they get stressed and they get depressed, and it might result in childhood trauma because sometimes it is the child who has to take care of their ill parents. May I please have the next page? Okay, so how do we support HIV-affected children? We can support HIV-affected children by ensuring access to medical care, mental health services, and social support systems. So, as I said that sometimes there's need to leverage community healthcare workers to assess the needs of a family, especially these families that are affected to HIV, is because sometimes as social workers or healthcare workers who do not only work where the child is infected, but also where a child is involved, such as when they are affected by HIV. So we can ensure that their parents or their caregivers are accessing medical care in order to reduce the stress levels of the child, because once a child has to handle all this, it means that sometimes they might not be able to go to school because they have to take care of their sick parents or caregivers. Also, the affected child has to get mental health services, such as getting counseling regularly to ensure that they have a safe space that they can offload anything that is problematic to their health, mental health rather. Also, there should be social support systems. So social support systems are important because they help the child to cope socially. So basically, we are talking about a community that is able to give support to its children. So these children have to get social support to ensure that they cope. Also, there are community-based programs, family-centered approaches, and advocacy for the rights of these children. All this can play a pivotal role in improving their well-being. So there are community-based programs that can be put forward to ensure that the children are coping if their parents or caregivers are not feeling well as a family-centered approach where we can focus on the strengths of the family to ensure that a child is coping at the end of the day, and also advocating for the rights of the child, the standing of the health of the child, the education of the child, and the general well-being of the child, to ensure that even if their parent or caregiver is not feeling well, they are still treated as a child. They are still enjoying the benefits of being a child, such as getting all these rights respected. Also, providing children with psychosocial support. As I said before, psychosocial support is important because it helps the child's mind and their social aspects all in one to ensure that the child copes. Because if we do not provide these psychosocial support programs, sometimes the child might need to suffer and have problems when they are adults or when they're still children. Like, they might have the behavioral problems. So We can also provide them with education assistance. So there are organizations that specifically work with children who are affected with HIV, or children who have been affected to a point where maybe the child's parent is deceased now, and they now require this special kind of support. Also, we can introduce programs that offer HIV literacy to support HIV children. So these programs can help empower these children on how to take care of themselves and to take care of their relatives or caregivers whenever they are not feeling okay. And they can help the children to cope, and also they can help the children to be able to discuss these issues without feeling like they are being judged with the people that they will be talking to. I think there's no more page, right? Yes, that marks the end of the presentation. You're welcome to ask questions and to discuss if you can. Thank you.
Thank you, Mr. Tariro. I request the participants to submit their doubts and questions in the chat box, and Mr. Tariro will answer them accordingly.
How does HIV affect the immune system, and what are the signs and symptoms to look for? Okay, so HIV is a virus, and when we are talking about virus, it means that there are many symptoms. Then AIDS is the disease, right? So how does HIV affect the immune system? So if one is HIV positive, it means that they are vulnerable to a lot of diseases. So the early signs of HIV usually can appear within maybe from 2 weeks up to a month after an infection, and sometimes they come in they might appear as rash, a cold cough, headaches, but it's generally hard to express the signs and symptoms to look out for it because they are many, and it's just advisable to just go to get tested when you feel like maybe you're engaged in non-protected sexual activities, or you've been in contact with maybe you've shared objects with somebody that is infected. So basically that is it. I hope I've answered you. Okay, thank you.
As we are near the closing ceremony, before we depart, we would like to thank Mr. Tariro, Dinesh sir, Simran ma'am, Pradipta sir, and my responsible team members for making this webinar a success. Thank you.